This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast. Justin Gomez here from Wake Forest Baptist Health. Hope everyone is staying safe and healthy these days, and everyone is doing the best they can to take all the precautions as we still work through this COVID pandemic. And we will be talking about COVID on today's episode. Just a reminder, everyone listening, you can listen to our other Best Health podcasts via our website at wakehealth.edu/podcast, or you can download them from wherever you download your podcasts that you listen to on a regular basis. So we will be talking about COVID today once again. And when we discuss COVID matters, I just want to take the opportunity to remind everyone that there is a good resource page at wakehealth.edu/COVID, wakehealth.edu/COVID, that has a lot of information that's updated on a regular basis. And hopefully you all can glean some good tips from that website. Now today, one of my favorite guests, he is a repeat guest. We've had him on the Best Health podcast before. He is the Chief Health and Wellness Officer for Wake Forest Baptist Health, Dr. Bill Satterwhite. Welcome, Dr. Bill. How are you, sir?
Thank you so much. I am doing well, considering our overall context of life.
Yes, that's a good way to put it. We are all given a response to that question, I guess, through a lens, a different lens or prism these days. Yeah. But glad that you taken the time to join us. As I can imagine how busy you are these days, and we're going to get into that in a second. But before we do, I just start off by reminding the audience who you are, a little bit about yourself, and why you got into medicine.
Yeah. Thank you. Thanks for having me. Well, I am a doctor who has been at Wake Forest Baptist Health for 5 years now. And I really came here with the specific mission of saying, how do we think about doing healthcare differently? Mm-hmm. Healthcare, for the most part, in America is all about sickness and disease. And what does it look like to begin thinking about healthcare from a health and wellness perspective? Mm-hmm. And so, you know, the goal in life is to never be sick, never need a doctor, live a long, healthy, happy life, and then, die of old age doing your favorite thing, right? And so how do we begin to think about that? I have been in Winston-Salem almost my whole life. I was actually born at Baptist Hospital decades and decades and decades ago. And I am married and have 4 children and 4 grandchildren, and my parents are still alive. And so we have, deep roots in this community. They still live here. And certainly a real desire and passion to have this community be a healthy place, really with all the fullness that word means.
Yeah.
Before COVID, it meant one thing. Now, during COVID, it perhaps means another. But, it's still all moving in the same direction. How do we get to the place of our own best health, given wherever you start, right? Wherever life is.
Sure. Well, and that's a good point you bring up. That's, I almost wonder, years from now when they have COVID in some of the history books, or we're looking back at 2020 as a year, this, is kind of a watermark spot where it's kind of life pre-COVID and then life post 2020. And, I wonder, I think people look to leadership in times of difficulty or stress. And, you are the chief wellness officer. So under normal pre-COVID circumstances, your calendar is full. You have a lot to manage, employees and making sure that the strategy and mission of health and wellness is you're trying to reach your goals. And then COVID just, it flips everything on its head, and for a lot of people. But I'm interested to learn, as your role as a chief health and wellness officer, we've been dealing with this for many months now. And, there's staff, there's frontline workers that are stressed. And of course, we've had, we just discharged our 1,000th patient, COVID patient from our system.
Right.
So obviously we've had a lot of COVID patients, and that's very stressful to have COVID. You know, what do you look to? I mean, how do you provide encouragement, or what are you telling people to say, you know what, we can stay the course, or we're not going to stay the course, we're going this direction? Just give me your thoughts on that. I'd be interested to hear from you.
Yeah, sure. It is an upside down moment. Certainly, much of what we have done for our own employees, and then for employees of other companies outside around, have all been leaning in a direction of saying, how do we move the needle on health for those people? And sometimes that's things like, appointments with nutritionists and particular exercise and workout routines and other information. Sometimes that's actually having on-site nurses or health coaches, or even on-site clinics. Mm-hmm. And we've actually rolled into that on-site counselors for behavioral health needs. So all of that was happening pre-COVID. Most of that leaning in a direction of saying, how do we sort of start at this baseline where people are, and then move them down a path toward, helping them get healthier. So think about it like your car. Some things need an immediate fix, and then other things are a bit more long-term maintenance. And so how do you keep it running a long time? And I think obviously with COVID, what happened was, it was a bit like a bomb being dropped, right? Yeah. And all of a sudden, everything changes. And it doesn't just change for some people, which is often the case with different catastrophes that happen. It changed for everybody, right? Yeah. It didn't matter if you were rich or poor, black or white, young or old, Christian, Jewish, Muslim, nothing, whatever, right? It didn't matter. All of a sudden, there's something that now is out there and going after everybody, every age, every stage. And no respecter of persons, we would say, again, it doesn't care whether you're rich or poor. It doesn't matter. It doesn't care what kind of car you drive or where you live. It is like, nope, this is out there and now a threat to everyone. And so suddenly the urgency of acting and thinking was different. The pace of that was very different. Mm-hmm. So whether it was internally for our own employees or externally, we really began to flip from saying, how do we do the sort of normal things pre-COVID that are a little bit more along the line on how do you, help your car be healthy and maintain it for a long time, to suddenly it's like the car's on fire and breaking down. And so we, began staffing all kinds of critical infrastructure businesses to help them with screening people with questionnaires and temperature taking, to try and help them avoid illness entering the factory, the plant, the office, and getting shut down. Mm-hmm. And we stood up on-site clinics in as little as 2 weeks. I mean, we just sort of exploded going out. And so oddly enough, at a time when a lot of, businesses and things and some parts of our own health system were slowing down, we were actually ramping up. Yeah. Candidly, I have never worked as much in a 3-month period since I was a resident in training.
Wow.
When you basically work all the time. And during kind of April, May, June, because suddenly everyone's scrambling, the earth has shifted and everything they're doing is different. And a lot of places of work had to act like a healthcare institution. And then, suddenly they're having to think about, stopping germs and cleaning and all this sort of stuff that normally only happens inside our big hospitals, right? Mm-hmm. That kind of thing's been going on forever in big hospitals. Nobody really knows it because it's never come to the front. And now it's not only come to the front in a hospital, it's suddenly at everyone's doorstep. Yeah. And they're having to sort through that. And so, we ramped up with people, we ramped up with technology. I mean, one of the things that became clear to us and to the people we were serving was there is no way to sustain this kind of 24/7 screening and answering questions and all this with real live people. It's too expensive. It's too hard. Mm-hmm. And as the number of cases began to grow in COVID, there almost weren't enough people to go around. So we created a web-based digital tool, which I know you've heard of, called Sneeze Safe, which works on any device. Companies sign up for it. We send their employees a text reminder. They fill out a quick survey before they leave the house. It says whether they're sick or well. And if they're sick or have any concerns or symptoms, boom, that automatically digitally sends a, in essence, I'll call it a text, a page, an alert to, our triage nurses who are going to sort out, is this person okay or not okay? What do they need? And so it's very fast, very real time. And you can imagine it like Amazon same day delivery, where you're like,
yeah,
I just hit buy and all of a sudden my doorbell's ringing and something has arrived, right? And it was trying to get to that sort of a place. And so been highly effective, multiple businesses, and even, Wake Forest University is using it for students too. So it converts well for that. And they credit that actually largely as one of the key components in their being able to maintain college open and in person.
Okay.
There's a lot of that's had to happen that, if you backtrack 6 months ago, that thought was not in our head, right?
Yeah.
There wasn't that. But one of the things that happens in a crisis is you do get lots of innovation. You do get innovation that can be done differently that never were, just because status quo pre-COVID was okay, good enough. Even like drive-through flu shot clinics, right? So think about that.
Yeah.
I suggested that 5 years ago at a couple places, and they're all like, no, that's crazy. Why would you ever do that? Right.
Yeah.
And now all of a sudden everybody's doing it. As an institution, we did it for our own employees. Lots of companies did it. We did it for them, staffing it. Right. No problem. Everybody goes, this is the best thing ever. So a lot of times you get some incredible innovation and transformation out of crises. And so my hope is that will be a lasting legacy from this infection.
Gotcha. Yeah. Speaking of innovation, one of my favorite stories was the idea of, back in March and April, there was just so much we didn't know about COVID, and we were there was different data coming in almost daily, and this idea of, going from this idea of people wearing masks. Every citizen wearing masks was such a foreign concept, right? It's just only doctors and in ORs that were wearing masks, right?
Yeah.
And the idea of like, well, where are we going to get, 300, 400,000 masks? And then the idea of the innovation quarter was just the partnership with us and Renfro and the Nightingale mask was pretty cool. So you just want to share like a quick recap of how that came to be? Because I think
also one of the more probably stunning things I participated in, probably besides getting married and the birth of my children, was Mask the City initiative, where, once I really began to think about it, kind of once COVID-19 made landfall in the US, I thought, oh my gosh, we're all going to get it because we have no natural immunity to it. Like no human on the planet that anyone knows of has natural immunity to this thing. So why wouldn't we all get it? And what in the world are we going to do? And vaccines classically take a long time to make. Now, maybe we can touch on that in a minute. But and so there was some evidence, enough evidence in the studied literature, the medical literature, that said masks are helpful at decreasing the spread of infection. Now, historically, most of the studies had been done in the hospital setting because that's where most of the infected people were, and that's where the people wearing masks were. But there were enough out there, particularly after the H1N1 outbreak of flu that happened a handful of years ago, where there was enough data for me to go, you know what, masks are going to be helpful. And the reality is, if everybody wore a mask and said 1, 2, 3, go, let's all wear a mask, that the giving and receiving of the infection would be greatly diminished. And so that was really the whole idea behind it. And, I circled up some of my team who were good at making things and say, we got to figure out how to make a mask. And I said, I have no idea, but this is what we need to go for. And then, within a week, we had connected with Renfro, who's the largest domestic sock manufacturer in the world. And so their business was kind of down, right? Because all of a sudden everybody was locked in. And so we were able to work with them to design some masks that they then mass produced. And I kid you not, within 29 days from when we first met with our team and said, we need to do something, 29 days later, they are cranking out 50,000 masks a week. And as you and others know, within a handful of weeks, the whole city of Winston-Salem had either bought or had their employer buy or been given a face covering, right? And while the face coverings aren't perfect, it's like, look, all you have to be is good enough if everybody wears it.
Yeah.
And
Right.
so over 350,000 masks were distributed. I mean, it was stunning. It was stunning. And it was a great moment of, community unity. There were no protests about masks. There was no pushback. We were so early that they hadn't even been mandated by anybody yet.
Yeah.
It was just kind of a bunch of people innovating, saying, we think this will be helpful. It's the direction we need to go. Come on, let's go. Time matters.
Yeah, I totally agree. Just kind of the example of so many different aspects and organizations and entities in the community coming together to accomplish.
Yeah, it was like 180 of them.
Yeah, it was.
180 came together, distributed them all. I mean, it was like the people's army. It was stunning.
Yeah.
I did very little other than kind of start the spark, blow on it a little bit, and then other people ran with it.
Well, it was a pretty cool initiative, and that was several months ago, and here we are many months later, and there's still data coming out, and the idea about a vaccine, we'll get to that in a minute. But before we do, what is right upon us is we are right smack dab in the middle of holiday seasoning. I'm thinking about the holiday food here.
You're thinking about cooking, yeah.
I am. So with the holiday season amongst us right now, obviously we got a little bit of a taste of it with Thanksgiving, and we have other holidays happening or getting ready to happen here through the new year, and Christmas and Hanukkah and Kwanzaa, and then New Year's, where there's usually a big celebration of a bunch of people getting together, and there's traditionally there's mistletoe, people kissing, and people hugging at midnight on New Year's Eve, and that's got to be different this year, right? Because of COVID.
Yeah.
So I guess talk to us a little bit about that. Maybe give us your thoughts and a couple of tips on how we can, what we can do to protect ourselves and our family from this potential spreading event during the holidays if people get together and don't protect themselves.
Yeah, and potential catastrophe for some, right? And so we have this very difficult sort of moment, right, where we're on the threshold of vaccines being available, but that'll take a while to actually do, and the collision really of the fact that we need to stay apart because of COVID and the ease at which one spreads that infection, and the desire and need as human beings to be together. We really weren't created to be alone, and we have this need to see people that we care about and they care about us and that we love, right? And so those are on a collision course.
Yeah.
So first of all, you have to recognize that, it's not a situation we want to be in, and it's a hard moment. The second is that certainly for people who are high risk themselves or for loved ones who are high risk, they absolutely need to consider, taking a rain check, doing a virtual holiday gathering, and say, you know what, in 6 months or 12 months, we can get together and have a big time.
Yeah.
Right. And I think that's something a number of people in our country need to seriously consider, is saying, we'll sit this one out. Right. Now, for people who are going to go ahead and be together because they have to be, because they want to be, because they're not high risk, whatever their reason, there are a couple things to think about. One would be, before leaving, make sure everyone who's gathering together has no symptoms.
Yeah.
And I mean symptoms of anything.
Right.
People that have a cough and a runny nose can have COVID.
Yeah.
Again, a year ago, you'd be like, well, that's stupid. I'm not going to the doctor and I'm not getting that checked out. I never go for that. Right. Well, this year, you might ought to think about that, especially if you're visiting Granny. And so ideally, no one would have any symptoms. Some, it might be helpful to get a test ahead of time. Some not. Kind of depends on the context where you are. And then once people are there, they really need to be smart. Right. Yes. You don't have to be foolish. You don't have to get COVID. It's possible to gather together and have that be a very low risk event, not zero risk. There's no zero risk option for living, but have it be a low risk. And so that's things like saying, how much can we do outside when we're together with people who aren't typically in our little bubble, right? You'd be amazed at how much you can do outside. And of course, us in North Carolina, we're used to pretty good weather. And so if it's 50 degrees outside, we think, oh, it's too cold to eat dinner outside when it's 50. It's actually not. If you lived in Minnesota or Wisconsin, you'd probably be outside having a picnic if it were 50.
Yeah, be grilling out.
Right? Yeah. And so you do more outside. You say, when we're inside, we're going to increase ventilation by having windows and doors cracked. We're actually going to turn on any fans that we have, and we're going to all wear masks as much as we can. And as is practically possible, you particularly have to be careful about eating. How do we spread that out? How do we create large spaces where we can do that? And that's really key when you're together. And then afterwards, you have to stay in touch. If anybody starts having symptoms within the next 7 or 10 days, that is a potential signal that you got COVID, and you got to get tested, and you got to tell everyone. And, again, it's not high risk for everyone, but it is for some people. The people that are most high risk are people over 70 years of age. I mean, their mortality rate is super high, like 4 times everybody else's. And most of the deaths in America have come from people over 70. The second highest crowd is anyone who's significantly overweight or obese. That, for some reason, is a high risk factor. Nobody knows why, right? But others can get through it and are fine. And then some people are still having lasting issues. So you have to be smart. Be smart, be smart, be smart.
Yeah, that's good. Those are good tips. Good advice, Dr. Satterwhite. And I like the idea of, you mentioned 6 months, maybe just postponing. I've heard of some families talking about, Christmas in July gathering.
Yeah.
It just hold off for a few more months till the idea of the vaccine can be distributed more widely, and hopefully this gets tampered down a little bit, and look to doing a gathering just delayed a few months. And in the grand scheme of life and protecting loved ones, that's maybe a sacrifice that a family can do to help each other, right?
Yeah, totally. I mean, totally. And, we're such a convenience oriented society, and we're used to getting what we want more or less, that delaying something like that seems hard. But again, historically, it would happen all the time. It certainly happens now to people in places like the military and other things, where they're, on a submarine for 6 months because they're doing their duty and doing a tour, and it's right through Christmas. Or World War II, where lots and lots and lots of people, were not around for several years in a chunk. And so this is just, part of that, part of what's going to be in the history book, right?
Yeah, that's interesting. That's a good way to look at it. Yeah. Now, I heard you talking to some of our Best Health for Business clients, our corporate wellness clients, about this. And I thought it was really good, and kind of just 3 really good nuggets that I thought would be good to share on this podcast. Some of the myths that maybe you can bust just with your expertise and common sense ahead of more potential family gatherings around the holidays, or people just whether by choice or not, maybe just a larger group of people congregating together for some reason. What are some myths that you want to just get out in the air and talk about here, and hopefully people will listen to this and be like, what, that's right. We should bust that myth. So I think there were 3 of them, and if you want to go over those, I think those would be really helpful. Yeah.
The first one, which cracks me up, is well, I know these people. Right. So well, I know these people, as if knowing someone means that they can't get COVID, and if they do, they can't give it to you. I mean, that's crazy. Right. We're not talking about like a robbery. We're talking about actually an infection. And so the fact that, that's my sister, that's my brother, that's my friend, that's my whatever, it's like, okay, do they ever leave their house? Right? If they do, they're at risk, or anybody else in their household ever leave. And so this idea, well, I know them, or, I kind of know what they do. My thought is, you actually don't, that, and you just need to accept that. Here's the risk of that. Don't fool yourself, because they're your child, your parent, your colleague, your whatever. Second myth is masks don't help. And now the scientific data and the studies are catching up to where, we as a city, Winston-Salem, were in March, April, May, June, when we were doing Mask the City, which is actually, they're stunningly effective at decreasing both the giving and the receiving of infection. And now, because everyone's wearing them, and now people are studying it like crazy in terms of the community, the population at large. It's like the single most effective thing you could do, period. I mean, it's crazy how effective that is. So I highly encourage people to do that. All the stuff about how they don't work, or they make you sicker, or they make you get it more, whatever, all that is totally false.
Yeah.
Absolutely false. The third thing is that getting COVID is not that bad. Well, the first thing I'd say is if I had to say true false, I would say false. That's not true. There are people who have died in every single age group, from infants all the way to really old people.
Yeah.
Now, as I mentioned earlier, everyone doesn't die at the same rate. So the younger you are, the healthier you are, the less likely it is to be significant or severe. And the opposite is true for older adults. But first thing I'd note is more people have died in the last 11 months of COVID in the United States than all the soldiers that died in World War II for the United States of America.
Wow.
We have crossed that line, right?
Wow.
And we have done it in less than 12 months.
Yeah.
And so when people think back, and there was a big impact from that many people, mostly men, dying, in a handful of years on the US, right? Same thing here, only boom, condensed. So lots of people have died, and until everything settles out, more will die, unfortunately, depending on our own actions and behaviors. And then the other thing I'd say is plenty of people have long-lasting effects from COVID. So there are people who got it and it wasn't that bad, sort of in quotes, and yet they still have this thing called brain fog. They just can't concentrate, almost like they got a concussion or something. And they have some people who have significant breathing issues that remain long after the active infection is gone. And, they're like, no, I still can't run and exercise, or I get out of breath when I go up one flight of steps. Yeah. And so there's more to it than meets the eye. I would not be too sort of cavalier about it. I would not be, because you don't know what your path is going to be. Sure. You do not know at all. It's a bit like, here's an inner tube, go jump in the river if you want to. Could be a calm river ride, or guess what? You could be going over Niagara Falls. We have no idea. Right. And so it's like, that'd be pretty stupid to voluntarily do that, especially with a vaccine, appearing to be on the horizon. Right. In a good and effective way. So I'd be like, no, man, now is not the time to do something foolish.
Well, yeah. And that's a good segue, Dr. Satterwhite, as we're talking about, the COVID during the holidays and kind of, what's coming up here soon. And if we can just hold on a little bit longer, it's been in the media a whole lot. Media is talking about it every day. Social media is there's tons of posts on this vaccine, right? The COVID vaccine. Yeah. Both on the research and development of just how fast it came to be in existence, and also now with the approval and seeing the trucks and the planes load up the first shipments, the idea that it will be available in the near future. Yeah. So maybe just talk about the idea of the vaccine and your thoughts on the R&D side of it and just the lightning pace at which it was developed, and then the idea of it's not magically going to appear on every doorstep tomorrow. Right. So if you can maybe talk about that for a minute, I think that would be helpful.
Yeah. So the vaccine development has been quite thorough, quite extensive, quite complete, and also amazingly fast. Mm. And historically, the fastest a vaccine was ever produced was actually 4 years. Now, this was probably 40 years ago, 50 years ago. So things have moved quite quickly since then. And in terms of just the science, the development, the know-how, just the ability to create and make and test and do way better than it was, back when I was a boy. Sure. And so I knew it would be faster than that. My guess had been from the beginning that it would take 2 years. That's probably going to end up being fairly accurate from the standpoint of, here we are essentially a year down the road, developing and having it. And then it'll probably take a whole nother year to actually distribute it, again, all over the world. Most vaccines, when they're made, are more targeted than that. They're for small children, they're for old children, they're for people, old adults. They're for people with a certain problem. Well, now we're talking about the whole world, right? Yeah. And so, that's kind of a heavy lift right there. And even if it's just the US, that's 330 million people that need 2 shots, right?
Yeah.
And that's not easy. And so, in my mind, it'll probably be 12 months before that work is done. Now, the thing that's been amazing, in addition to the speed, has been the thoroughness. They've actually managed to test this on thousands more people at the front end than normally happens, particularly in that kind of a timeline. And so, each one has the ones that the US is going to use, I've had 30 or 40,000 people already gone through it with virtually nothing significantly bad happening to them, which is pretty stunning, actually, and a really good sign. And while, vaccines aren't perfect, again, there's no risk-free path to living, right? Whether it's a vaccine or driving your car or, eating shrimp, it's still not risk-free in any ticket for life. But it appears to be highly effective and very, very, very low risk. And it also appears to be the only way out, right? Yeah. I mean, because the other option is we just go, well, why don't we just wait, let nature take its course, and, once 70% of the US is infected, maybe there'll be some herd immunity, blah, blah, blah. Well, first of all, you're talking about 200 million people. We need to get it. Right now it's only a handful of millions that have gotten it. And we've already had hundreds of thousands of deaths. So how many people are going to die if we do that? And how long would that take? And what's the consequence of that? Yeah. When in essence, we have almost a magical remedy, right here. And vaccines, if you were to ask me what were the most significant health interventions, whatever, treatments that have come up, in the last 100 years, there are 3 things. There's clean water, there's sewer, and there are vaccines. That crushes everything else. That crushes every medication, that crushes every, surgery. I mean, it doesn't matter. Those have been the most significant, interventions for the health of mankind over everything. I mean, again, it crushes it. And so here we have this urgent need worldwide, and there is a worldwide solution, right? Yeah. And while it's not perfectly known, hey, you're in a pandemic that no one's ever gone through. Nothing's perfect. Nobody knows where a lot's going. So I am delighted that it has happened in such a short period of time. And, all states and health systems, there's a sort of an order to distribution, but
right.
Whenever it's my turn, I'm moving to the front of that line when my group is called. And I don't think that will be a high risk or foolish thing. I think it will be wiser and safer than rolling the dice and saying, well, maybe I'll just get it and we'll see what happens. I think that's the more foolish pathway.
Gotcha. Well, that's good info, Dr. Satterwhite. I know people have a lot of questions and it's on people's minds a lot right now just because of all the attention it's getting everywhere. So that's, I appreciate that. And, as we wrap up, we've been talking with Dr. Bill Satterwhite. He's the Chief Health and Wellness Officer for Wake Forest Baptist Health. And we've been talking about a few different things about COVID, especially during the holidays and, what we can do to be as safe as possible. Now, we're talking about vaccines here. So as soon as I get a vaccine, let's say, is life good? Can I go back to pre-COVID? I don't have to worry about wearing a mask.
Oh yeah. Great question.
Can I, who cares about social distancing once I get the vaccine? Is that the case, or do we still have to be careful a little bit?
Yeah, so that's not the case. And there are 2 things you need to know. First of all, you have to get 2 of them to be effective. Mm-hmm. So 1 shot alone will not get you there.
Gotcha.
And it won't even get you close. It's really fascinating. That kind of wakes up your immune system, but the second shot is really what gets it going. And so that's really key. The second thing is because it is going to take a while for everyone to get vaccinated, and because right now no one knows how long a vaccine will last. So some seem to last forever, like polio that you got as a kid. Man, you could jump in a pool full of polio and you wouldn't get it. It's stunningly effective. Others tend to wear off. Tetanus, you get a booster. Flu shot, you get every year, right? And so we don't yet know, is this bulletproof like a polio vaccine, or is it more like the flu? You need it every year or whatever. So nobody's sure about that. And so the best thing to do for the next 12 months is to say, I'm going to keep doing what I've done the last 12 months, which is wear a mask, be wise about distancing and social gathering, and wash my hands a ton. And we're just going to, take the safe path and see where this goes. That would be my advice.
Well, Dr. Satterwhite, that's good advice and just lots of good nuggets of wisdom that you shared today. And hopefully anyone listening to this will find at least some, if not the whole podcast, useful in some way and share it with their friends and family, especially as we're in the middle of the holiday season. And,
yep.
Thank you for your time and appreciate all you're doing to help, during this pandemic, as far as, pivoting and trying to keep people healthy. So
yep.
Appreciate what you and your team are doing.
Yeah, my pleasure.
Well,
stuff. We have to be smart, be safe, but live life.
Yes.
There you go. It's my bumper sticker.
That's a good, the bumper sticker. That's a good bumper sticker. Those are good closing words to put it on that bumper sticker. So I hope that you and your family have a very happy and safe holidays.
Yeah, you too.
And, in a few months, I'd love to have you back, once more people get into vaccine and we can have an updated conversation.
Sounds great.
All right. Well, have a good one. Thank you so much.
All right, thanks. Bye.
Everyone listening, thank you for listening. Hope everyone also has a safe and healthy holiday season. And, it might be a little tough right now, but there's a light at the end of the tunnel. And so let's all hang tough and be smart, like Dr. Satterwhite said. And, I think better days are ahead. So until next time, everyone listening, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.